You know, there may come a time when you've been in an accident, you need some rehab or someone you know. What do? Well, you call the folks here at Community Rehab Physical Therapy Center. How are you?
Good.
Melanie Fayard is one of the physical therapists here. And they actually have two locations where we are today at the corner of Community Road and David in Gulfport, and you also have a location in Diamond Head.
That's correct.
All right. Now, what we're going to be talking about right now is the aquatic therapy. If you would, tell us a little bit about Community Rehab. Been here for 18 years.
18 years,
That's
yes.
awesome.
Yes. So we are a private practice, been in business for 18 years. We have a great staff, great patients. We're excited to see our patients. We're locally owned and operated, so you're dealing with the people who live here, work here, and want to make sure that you get better.
That's a good thing. You have so many different things here to offer when it comes to rehab. I know one of the popular ones is where we are right now, and that's the pool. Talk about the aquatic therapy that they can get here.
Absolutely. Well, we are excited to offer aquatic therapy as part of our physical therapy program. We have found that it has been great for our clients. There are a lot of people that have difficulty exercising because they might have arthritis, that it just makes it too difficult. And when they exercise, it makes their pain worse.
Right.
So we have found that when you're in the water, waist deep, 50% of your body weight is off your joints. If you are in the water neck deep, 90% of the body weight is off your joints. And it just is a great medium to exercise in. It's less pain. Our pool is heated. It's kept between 89 and 92 degrees.
Wow.
So it means that your joints are warm, and it's a much more comfortable environment for people to exercise in.
What kind of conditions do you treat with aquatic therapy?
So we treat a variety of conditions here. We are able to see people that have had knee surgery, hip surgery, shoulder surgeries, any type of joint issues. We see a lot of people who have arthritis, that, like I said, they just find it too difficult to exercise on land. We also work with our athletes when they are returning to their different sports. Initially, you want to try them out in what we call plyometric activities, or jumping activities, and it's a much safer environment for them to be able to do it in the pool. We also do a lot of balance training in the pool. A lot of people that are having troubles, they might have had a couple of falls lately, and they're afraid to do some exercises on land because they're afraid they're going to fall. The pool is a great area for them to work in.
Now, I see that they can just wear a t-shirt or swimwear or whatever to do so.
Absolutely. The pool is, we make it to where it's their comfort level. If you're comfortable in a bathing suit, absolutely wear a bathing suit. Some people feel more comfortable with t-shirt and shorts, and that is completely acceptable.
Now, why choose aquatic therapy in Gulfport?
Well, ask our patients and they will tell you aquatic therapy is a lifesaver for them. One of the big pluses that we offer here is after you've completed aquatic therapy with us, we also allow the patient to continue a private pay program on their own that they've learned here. Plus, our programs are customized specifically for each patient. You're not all doing the same thing. It's specifically for what your problem area is.
Okay, well, you've got some other great therapy regimens that they use here at Community Rehab. Let's show you something really cool. H.H. Park is a certified physical therapist here, and you specialize in dry needling.
Yes.
What is dry needling?
Dry needling is actually another tool that we can use in physical therapy to try to treat pain. We're talking about pain in muscles, tendons, ligaments, areas around the nerves. So that treats various conditions such as chronic pain. So that could be your neck, your back, any kind of old surgical pain that you still have after surgery. Also treat. We also have conditions like fibromyalgia that patients deal with on a daily basis. Also, actually, Nate here actually has TMJ pain. So we have some jaw pain going on. And TMJ is actually a very interesting joint because it's a single bone that's connected to both sides. So any kind of muscular imbalance can also cause tightness on one side. So I'm going to be demonstrating some insertions to the masseter muscle here. So what I do is I kind of palpate, see what's going on. And then once I get a point that I can actually go in, do that, pop that in, and I wind it up a little bit. So by adding that needle, I'm adding stimulation to that area. So a lot of times when we have pain for a long period of time, the body starts dismissing it, even though you feel it on a daily basis. So we're trying to add that stimulus so that the body can kind of reset that pain pattern and pay attention to that area.
Now, what is the difference between dry needling and acupuncture?
Now, it's a different school of thought. Acupuncture is more Chinese medicine based, so it's looking at how the energy flows in your body, and we're trying to restore that energy flow to try to treat different diseases and ailments. Now, dry needling, we're actually looking at muscle tightness, muscular imbalance, so we're going actually to those areas directly.
Now, what can I expect after a dry needling session?
So because we are going into those muscles, you may have some residual soreness. So we do tell patients, make sure you put some heat on it. You can also stretch it out, drink plenty of water to try to reduce that soreness as much as you can. And we can also do those modalities here after the treatment so that we can be as pain-free as possible after the treatment.
That's amazing. That's amazing. One of the other things uniquely that they do here is called cupping. Let's show you that next. Marie Maples, what is this?
So this is cupping. This is a form of manual therapy that we use to try to help decrease pain in any of the tissues that you may have. When we apply the cups, they're actually doing a pulling action, and that pulling action can help decrease any tissue adhesions or anything that's stuck down inside of the body.
Right.
When things are stuck, your body tends to not move the way that it's supposed to. Those faulty body mechanics are what end up causing you pain because you're not moving well.
Right.
So when we apply these cups, they can decrease the tissue adhesions, thus decreasing your pain. And they'll also tend to pull out some interstitial debris, anything that's down in those tissues that's been trapped for a long period of time.
Now, it doesn't actually pull it through the skin. It just pulls it up to the surface.
Not through the skin.
Underneath it.
Yeah.
So that way you just naturally flush it out.
Correct. The lymphatic system will take over and move it.
Does it hurt?
It does not. As long as you apply it correctly and you take your patient's needs into consideration, there should be no pain, maybe a little bit of an intense feeling, but nothing that's harmful to you.
Okay. And what about the marks it leaves on your body?
Okay, so the marks that you'll tend to see, that can be a sign that you're actually removing some of that interstitial debris.
So that's a good sign.
Trapped. It is. It's a good sign. It means that we were working on an area that actually needed a little something extra.
So what kind of other kind of issues can you treat with cupping?
Any form of pain or muscle tension that you have. But I see it a lot. I treat a lot of chronic neck pain, back pain, shoulder pain, especially with frozen shoulder, and I can even use it after a surgery if you're having trouble getting rid of your swelling.
Really? Wow, that is really interesting. Who was it? Michael Phelps is the one that kind of brought it to everybody's attention.
Got a lot of publicity after that.
Yes, he did. Well, thank you. I appreciate that. If any of these things, physical therapy items can work for you, what you need to do, of course, is go check out with your regular doctor and find out, because you would need, for insurance purposes, to get a referral from your regular doctor. You can come in and get a consultation and find out which would work perfectly for you. From the community rehab here in Gulfport and also in Diamond Head.